What is the role of chiropractic massage in managing pain? I have to admit, that's my favorite part.
The massage
The
part?
massage. It
I
feels
mean, who
so
doesn't?
good. I know.
Yeah.
Well, I employ massage therapists in my office, and we offer all kinds of different massage technique. We have lymph massage, we have therapeutic, we have myofascial release, and craniosacral. So massage is an effective. What am I trying to say?
That's a great compliment.
Yeah,
to
it's
the
a
structural work
compliment.
that we
Thank
do.
you. That's a
Compliment.
great word.
Okay.
It's a
Yeah.
compliment to the chiropractic adjustment.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Sayla, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Today's episode is so interesting to me. We are talking all about chiropractic care and how it can alleviate back and neck pain.
Back and neck pain is such a common ailment when it comes to, I feel like when we get older, you're like, oh, I just have to deal with it. Not necessarily, right? And we are going to be joined today by two doctors of chiropractic, Dr. Jane Brewer and Dr. Elizabeth Hoefer. And they're going to tell us all about how to alleviate back and neck pain through chiropractic care.
I'm so excited. Let's bring him in.
Yeah. Oh my goodness, today we are joined by Dr. Jane Brewer and Dr. Elizabeth Hoefer, two doctors of chiropractic. This is so exciting.
Yes.
Some people have so many questions, Sayla.
Yes, about neck and back pain, which are so prevalent in our society.
Yeah.
Sitting at desks, right? Driving so much. We are so excited to learn from you.
So, Dr. Brewer, tell me how you got started in chiropractic.
Chiropractic changed my life. I was living in a small ski town in Colorado, and I'll just preface this by saying I did not have chiropractic care growing up. I probably hadn't even heard the word chiropractor, so it really wasn't in my vernacular, wasn't familiar at all. And it wasn't until I got into a more active lifestyle and I was skiing in the winters and mountain biking in the summers, and I started crashing all of those things and hurting myself that a friend of mine suggested to go see the chiropractor in town. And it totally transformed my understanding of how the body works, how the body heals, and inspired me after 11 years of being out of undergrad, and I had an art degree, to go back to school to become a chiropractor.
That is an awesome journey. Dr. Hoefer, how'd you get into chiropractic?
It's so incredible. I actually grew up in Davenport, Iowa, where chiropractic was founded.
Oh,
Yes.
I did not know that.
Me either. Learn something new every day.
Yeah.
Absolutely. So I got a part-time job working at Palmer College of Chiropractic until I figured out what I wanted to do with my life.
Oh.
If for those of you who are just listening, she just did air quotes. So. Okay. But go ahead.
Yes. And so I was a single mom. I didn't have any idea what I wanted to do with my life. Before chiropractic, I wanted to be a singer on Broadway. So I got a part-time job working at Palmer. I loved being a part of the profession in a helping kind of way. And they had an associate's program at the college, so I thought that I could do that. Halfway through that program, I realized, gosh, I want to do more. And one thing led to another, and now I am 16 years into practice.
Wow.
That is incredible. And the two of you are best friends?
Well, we got to know each other. We independently completed our Doctor of Chiropractic degrees, and then many years later, after honing our specialties and really focusing in on head and neck, which is what Dr. Hoefer and I both do, we decided to embark on a 3-year journey to achieve our diplomate degree. So that's kind of a credential in our specialty. There are very few of us in the world who do what we do. I think there's about 60
In the whole
DCCJPs
world?
In the whole world.
Wow.
Yeah.
And so that's how we got to know each other. I think in a lot of healthcare professions, maybe a bit more male dominated. And so kind of as a cost savings, 4 of us women teamed up and we're like, let's just share a hotel room for these weekends that we study together and meet in person for class. And that's how we got to know each other, and the rest is really history.
Yeah.
And you've been best friends ever since.
Yes.
Yeah, it's been really fun. And just to have another woman in the profession that's as passionate about the thing that I love the most, which is the upper cervical neck, the atlas, and then just to be able to glean information and share, and we can like nerd out on talking about sciencey things, but then we also enjoy going on hikes, like in the mountains of Colorado or snowmobiling in Alaska or the beach in Orange County. So we just have a lot of fun together.
Yeah, you kind of have a long distance relationship too.
Yeah.
Long distance
right.
friendship.
It's a bit of a
But you
commute,
managed
but we
to-
make it work.
I love that.
And for you, Dr. Hafer, what makes you so passionate about chiropractic and specifically the back pain and the neck pain, that area?
That's an amazing question. Like Jane, it literally saved my life. I struggled with depression and anxiety and just overwhelming emotional issues most of my life. And when I got an upper cervical correction in 2007, it healed me instantly, and I knew that I had to spend the rest of my life doing that work and training other people how to do that work. So that's what I get to do.
That's incredible.
incredible.
Like the passion comes from like an internal source, and you're
Yes.
just trying to help other people.
Absolutely.
It's a
Yep.
testimony.
Yep,
really
I was
is.
blessed to be a blessing. I was healed to be a healer.
Oh, write that
That's
down. Put
so
that on a t-shirt. Put that on a t-shirt.
So good.
Yeah, well, let's talk about some of the common causes of back pain and neck pain. What would you say they are, Dr. Jane?
I think on a very general level,
Sure.
we have lifestyles that are a bit more sedentary than maybe they once were. So a lot of us are sitting. And even if we're not sitting, there's a lot of, even what we do every day, there's a lot of repetitive movements and, adjusting people all day long. That's wear and tear on those joints. And then because of our practice focus in the area of expertise that we have, we tend to see a lot of patients that come in because they've either had a motor vehicle accident, a sports accident that's created a concussion. And those people just need hope and they need answers. And sometimes a lot of folks that come through our offices have tried a whole lot of other stuff and unfortunately are seeking out chiropractic care as almost a last resort.
Oh, wow.
But then they actually find the solution that they're looking for. And so
Great.
if there's one message that I think both of us would like to share is there are conservative options to try first that can get you the relief that you're looking for too.
Right. And you mentioned some of the modern technologies, and would you say poor posture because of cell phones and computers and all of that are contributing factors?
Yeah, I would definitely agree. I think that our lifestyles are way more digital than they used to be. I didn't grow up with a cell phone or even computers,
No,
here in the
we didn't
library
either.
going through the Dewey
Yeah.
Decimal System. But yeah, I think our lifestyles have lent themselves to definitely different postural challenges that we need to be more mindful of overcoming.
Right. And what about pregnancy too? Is that another one people come to see you?
Yes. And so I'm certified in a technique called the Webster technique that is
yes.
specifically geared towards pregnant women and the unique needs of a changing body throughout pregnancy. And so it's really designed to optimize pelvic positioning to create a happier, healthier pregnancy for mom and hopefully a happier, healthier pregnancy for that growing fetus in there too.
Yeah.
Yeah.
Dr. Jane, what is the Webster method?
So the Webster technique is a very specifically laid out system of analysis and adjustment that's really designed to address the specific needs of a woman's body as it's changing throughout pregnancy. So during pregnancy, we've got all these hormones that are released that are preparing your body for the birthing process. So everything's all loosey-goosey, right? And things shift, things misalign. That can, of course, be uncomfortable for you, cause a lot of lower back pain. Some women during their pregnancy have pubic bone pain, depending on the way the baby's positioned in there. And so it's really designed to optimize pelvic positioning so that you can have a more comfortable, healthier, happier pregnancy. And then in turn, if your body's more optimally positioned, that's going to create better space in the womb for that baby to thrive as
And
well.
a better birth experience.
Absolutely.
I credit my VBAC to doing the Webster guide every single week I went.
That is
in
awesome.
my third pregnancy. Yeah. I really think that's a great technique.
One thing that's inherent in the chiropractic philosophy is that our bodies are incredibly intelligent and we just need to give it the conditions and the tools it needs to heal itself. And I think that's one of the most beautiful things that chiropractic recognizes. And that sounds like the experience that you
It was
had.
a good experience. It absolutely was a good experience. I'm very grateful.
That's amazing. One other reason I went to chiropractor during pregnancy, but also beyond, was sciatica. Can you talk a little bit about that?
Yes. So sciatica is an issue with a nerve that runs down the back of your leg, and it's very painful. And if you've ever had sciatica, it is crippling.
Yes.
What's so cool about the work that we get to do is that while the sciatica nerve starts in the low back and runs down the leg, it's actually likely a problem coming from the neck. So the way that we kind of tie it all together is we explain how the structure underneath your head, where the cervical spine is, if we can get that into alignment, the rest of the spine is going to line itself up, and it takes irritation away from the lower back, which allows those nerves to communicate more effectively and inherently take away the pain.
Interesting.
Which is exactly what people are looking for, relief from their
Yes.
pain. Go ahead.
Yes. So I was just going to say, in a more traditional look at chiropractic, more traditional method, they might go and adjust the low back. But we've found that when we actually take care of the root issue, which is the irritation at the top of the neck, the spine will align itself more effectively because we translate gravity all the time. And that allows the nerves to communicate more effectively to everything downstream from the atlas.
Dr. Jane, what's the connection between neck pain and headaches?
I don't think those two things can really be separated. We've got a very heavy head. It weighs probably about 13 pounds, and it sits on top of that little atlas bone that weighs a couple of ounces. So it's got an important job to do. It is not built for stability. It's built for mobility. We need to be able to turn our heads. So that's its primary role, but because it's so freely movable, it also makes it very vulnerable to misaligning. That's why we really look at that area as the structural foundation of the spine. And I know that's a little funny. We don't usually think about the foundation as something at the top. But when it comes to headaches, it can really, create an inflammatory response or just create the conditions that will cause irritation to those nerve pathways. And that can be a huge factor when it comes to things like headaches and migraines.
And you have to also remember that any kind of symptom in our body is information. So the pain of a headache, the pain of sciatica, the baby being breech, all of these things are symptoms of a deeper issue. And that's the fact that the structure isn't aligned the way that it's supposed to so that your brain and body can communicate. So when you get a headache, that's a sign that there's something that's off. The muscles are trying to tell you, we need to do something different. Yeah.
So that's how chiropractic adjustments help alleviate that pain because you're getting everything in alignment, essentially.
Exactly. So we really look at that through the structural lens. And if you think about the structure kind of like hardware and all the nerve pathways kind of like software, those need to be working in tandem together to have a fully functioning body. And if through accidents, injuries, wear and tear, that structure is not aligned optimally, it's going to have an influence on function. And if that function isn't 100%, then it's going to manifest as things like headaches.
A symptom, yeah. That makes sense.
What are some of the techniques that you use in your chiropractic care to help alleviate pain and help create more mobility for your patients?
Well, it's really cool because we each practice upper cervical, but we actually do it in a different way. So I practice a thing called Blair upper cervical, and it's more of an articular model where I look at the joints of the cervical spine from the atlas and the occiput all the way down to C7. And Jane looks at it in a little bit different way where she's looking at more of an orthogonal, balancing the head over the neck and using the atlas is almost like a washer to hold up the head. And so we look at things in a different way, and she practices orthospinanology. But there's all kinds of different techniques that can be employed to help alleviate the suffering of the human frame. We just like to focus at the top, and we do it in a different way with the same intention.
Yeah, kind of you can look at it two different paths to get to the same destination. And ultimately, I think where upper cervical is a bit different than a more traditional or general chiropractic approach, everything we do is image guided. Everything we do is very tailored for the individual. We're all put together differently. And just like we're not symmetrical on the outside, we're not symmetrical on the inside. And so those images that we utilize, and we both have 3D imaging technology that we employ in our practices, and we customize, and I measure down to the 100th of a millimeter how to adjust that person to create the most precise, effective adjustment. And the goal isn't to have to adjust people over and over and over again. The goal is to facilitate that adjustment, facilitate that correction, and teach that person's body how to maintain that alignment in its normal position for as long as possible, because ultimately, the longer things are positioned as they should be, the better somebody's going to feel.
Yeah, that's incredible. I did not have imaging done at my chiropractor. Is that normal, or can people expect that from most chiropractors?
So there are so many different chiropractic approaches and techniques, and truly I don't look at any of them as good, bad, right, or wrong. They're really just different.
Just different.
And that general chiropractic approach may be great for some people who might just need a little bit of work or to decrease some muscle spasm, increase some range of motion, or some temporary pain relief. But truly, at least from my personal clinical experience, if people are looking for lasting relief and a more lasting solution, a fix rather than a patch and tired of slapping a Band-Aid on the same thing over and over again. We really do the work and put in the elbow grease to get to the bottom of what's going on.
What is neurostructural correction? Dr. Hoefer, you tell us.
So it's when we are harnessing the hardware, the bones, the vertebra, to affect the function of the software, which is the nervous system.
Oh.
So it's simply marrying the application to the function that we want to restore.
Wow. And what is the role of chiropractic massage in managing pain? I have to admit that's my favorite part.
The massage
The
part.
massage.
It
I mean,
feels
who
so
doesn't?
good. I know.
Yeah.
Well, I employ massage therapists in my office, and we offer all kinds of different massage technique. We have lymph massage, we have therapeutic, we have myofascial release, and craniosacral. So massage is an effective. What am I trying to say?
It's a great compliment.
Yeah,
to
it's
the
a
structural
compliment.
work that we
Thank
do.
you. That's a
Compliment.
great word.
Okay.
It's a
Yeah.
compliment to the chiropractic adjustment because your soft tissues is where the issues lie. So if we can get the structure in alignment, then the muscles have to be reminded, hey, this is where we actually want you to go. So chiropractic and massage together are an amazing marriage to help people function well.
Oh, that makes sense.
In my research, I saw that there's such a thing as a chiropractic pillow. Have you ever heard of a chiropractic pillow? And if so, what is it?
I think that's a good marketing term.
Oh.
What I tell my patients,
You're like, because you're
Yeah.
making this face like, what?
well, it's because truly there's no magic pillow, there's no magic
Yes.
mattress. Every
Okay.
body is different. Every body in a bed with a partner is different. So we just tell people to stay neutral and stay supported.
Darn it. I just got sold an Instagram neck pillow.
Oh, and it might work for you.
darn
That's
the
exactly.
luck.
I always tell my patients finding the right pillow for you is like finding your favorite pair of running shoes or finding your favorite pair of jeans.
Okay.
It's going to be different for everybody. You might love that.
Well, supposedly it's going to help with that neck tightness, you
Yeah.
know, so who knows?
And as long as you stay neutral while you're sleeping
Yes.
and you're on your back or on your side, you're going to do well. So
I
maybe
see.
the Instagram pillow will be a hit for you, but it might not work for your husband, you know?
Right. Okay. That makes sense.
Yeah.
All right.
So I feel like as we get older, I mean, full disclosure, everybody knows we're in our 40s,
Yes.
right? That's not a surprise. But there are people of all ages who suffer from some type of back pain, especially lower back pain, the older I get.
Yes.
Are there any specific exercises that we can do to help alleviate that at home before coming to you, or I guess during care as well?
I think for lower back pain, and you'll probably hear this from a lot of sources, is strengthen your core.
Yes.
And your core is more than just your abdominal muscles. The core encircles the whole lower part of your spine. We develop muscular imbalances as we have habits and jobs and things that we do repeatedly every day. And so the tendency oftentimes is to, for example, have really strong quad muscles, but really tight and weak hamstrings. That's an imbalance there, and those imbalances can lead to pain. And so I think focusing on strengthening the core muscles, that's going to give your lower back a lot more support and happiness in the future.
And stretches. Like I know for my sciatica, I was doing hamstring stretches and glute stretches. Do you recommend those to your patients?
It just depends on the circumstance. And that's what's so cool about the way that we practice is that it's literally tailored to the body on the table. No one thing is going to be the same exact advice that we give the next person that comes through our door. So yes, stretching might be effective. Strengthening might be effective. Another thing that I was going to add to the low back conversation is the pelvic floor. And
I'm hearing more and more
Oh, I
about
yeah.
that.
And just
Yeah.
having given birth 3 times and you've had babies, the pelvic floor is an underappreciated area that needs attention. But again, it's innervated by nerves that come from the spinal cord that's housed by the vertebra. So it all comes back to structure.
I need to go to the chiropractor then.
I know. Well, they're
I'm
here
having
right
some
now.
major
Did you bring your tables? Can you make it nice ones like right after?
right now.
Right after.
Come down. We'll walk down the street and we'll get you
All right.
imaged.
Oh, that's
Perfect.
right.
Yeah. How can chiropractic care complement other treatment modalities like physical therapy?
gosh.
Yeah.
That is one thing that I love the most about what we do, and it's the collaboration piece.
Yes.
And, you know, the saying is it takes a village, and I really think that's true when it comes to taking care of ourselves, especially in the landscape of taking care of ourselves proactively and from a more natural-minded perspective. And I think education is where it's at. And we have an amazing referral relationship in my practice in Northern Colorado with other healthcare providers because we all shine in our area of expertise. And when they know what I do and they know how I can help and vice versa, it's again, going back to it, it's about the outcomes for the patients. And if I find that somebody else is going to be served better under somebody else's roof, I'm going to recommend they start there first and then get their spine taken care of. And I think that goes a long way with establishing that trust and rapport with other healthcare providers.
Yeah, that 100% makes
Yeah,
sense.
I remember there being an acupuncturist in my
Yeah.
chiropractor's
Oh,
office.
I've never had acupuncture before.
It's
I
wonderful.
Really?
Yeah, it
Yes.
was great.
And those are the kinds of medical professionals who you regularly collaborate with
All
as
the
well?
time,
Oh,
yeah.
really?
Acupuncturists, massage therapists, physical
Naturopaths.
therapists.
Naturopaths,
Yes.
yeah.
What's a naturopath? I don't know what that
Like
is.
a homeopathic way of
Yeah, so
diagnosing
instead of
and
using
healing.
Yeah.
Thank you.
prescription medication, they use supplements and do different kind of tests and hormone
Sure, I'm
things.
open
so
to it.
Yeah.
I just hadn't heard of it.
Yeah.
And then functional medicine is a big one
Yeah.
as well. And these are oftentimes MDs or DOs who just choose to look at things through a bit of a different lens. Like they can take your blood work that might appear normal by the numbers and the ranges, but still you don't feel your best. And they
Right.
can look and kind of dissect it and just find things that other more traditional providers are not necessarily looking for.
Are there certain lifestyle changes that someone can make to just support a healthy spine?
Absolutely. Spending more time not looking at their cell phone, just, not being glued to a screen at all times. I mean, we live in a digital world and it's really difficult, but getting better sleep, having a really good sleep practice where you get a regular 7 to 8 hours and it's at the same time every single day. Obviously, feeding yourself whole foods, organic foods, staying hydrated with water, staying away from, the unhealthy oils and the sugars and all that kind of stuff. I mean, just doing simple things to just feed our bodies better is going to lead to a healthier nervous system. And then that obviously leads to a healthier expression of life.
That makes sense. And as you said before, strengthening the core, exercising, keeping your body healthy as much as you can.
Yeah.
Which
Absolutely.
isn't just doing crunches and making sure you have that
Right.
six pack, right?
Right, exactly. Former personal trainer here. I'm like, go on, Melissa.
So I feel like we need to address the elephant in the room. There are so many misconceptions out there about what chiropractic care actually is.
Absolutely.
Let's start debunking some of them.
Let's
Here's
do
the
it.
first one. Dr. Jane, is chiropractic care safe?
Yes. And I don't say that as a personal opinion. I am a big fan of reading the literature and looking at the scientific evidence to
Yeah.
support that. And there are study after study after study that supports not just the safety of chiropractic, but the efficacy of chiropractic, the outcomes of chiropractic, and the patient satisfaction, where you really start to quantify and qualify how pleased people are when they start chiropractic care.
Would you like to add to that, Dr. Hoefer?
I agree wholeheartedly. And I think that we wouldn't have survived since 1895 if it didn't work.
That
Yeah,
long.
That's a good point.
Yeah.
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 I think people hear like one horror story.
Exactly.
Which may not even be from someone they know,
Yes.
but
Yeah.
there's just some
Yeah.
horror story circulating, and then they
course.
think, that's what's going to happen to me. I'm never
Yeah.
going to be able to
Yeah.
fill in the blank again.
Which can
Because
happen in any field.
100%. It's like
Yeah.
saying, well, I had a bad meal at a restaurant.
Yeah.
I am never going out to eat.
I'm
ever
never
again."
going out to eat
Yeah.
again.
Exactly.
Yeah.
And I've used the analogy of like, well, have you ever gotten a bad haircut or had a bad hairstylist?
Yeah.
You didn't never
Never
get your
get your
haircut again. You went and found a better stylist.
That's right.
Right.
So it's just about finding the person that works for you.
And then I'll just add to that to say that I've actually referred to other chiropractors in my
Yes.
community.
Mm.
And if I consult with a patient and find that what I do might not be the best fit for them, I think one thing chiropractors, and maybe this is a bit more untapped, is we need to be referring more to each other.
Yeah.
And if I don't feel like my approach and my technique is well suited, for example, like I don't do a whole lot of extremity adjusting. If somebody needs an ankle or a wrist adjusted, it's not my passion or my expertise, but somebody else in my community might be able to help with that.
That makes sense.
Yeah.
Yeah, I do think there's such a misconception about it. I remember even my own dad was a professional athlete. He was like, against it or whatever. Then my brother married a chiropractor.
Nice.
Who
They're
adjusted.
like, nice.
And now he's all about it.
Yeah.
Yeah. It's so funny.
Yeah.
You know what I feel like we see more and more these days? Social media and what you should do if this hurts. What do you think about people giving out chiropractic advice on social media?
I think there's a fine line to walk there.
Yeah.
And I think we just need to take care in how we're communicating that. I mean, millions, billions of viewers. So I think it needs to come from an educated perspective. I think it needs to come from a perspective of wanting to teach people. And it's a delicate thing. And I think it's a
Sure.
fine line. And, we want to make sure that we're not giving healthcare advice because everybody's
That part.
different. It's going to be received differently. But I think there's a huge place on social media platforms to educate people. And also, I think mostly let people know like there are other options for you out there if you are suffering with neck pain, with back pain, if you're healing from a concussion and things aren't getting better, or if you've had a motor vehicle accident, you just don't feel like where you are is where you want to be as far as quality of life, that there are other options out there. And I feel like if it opens the door to that, that's a good
Absolutely.
thing.
So that was what I was just going to say. Like, it's not all bad. I mean, there are some terrible things that are happening on social media and
Sure.
Right.
things that make my heart stop and my stomach turn. But there's also this opportunity to truly educate people about the power and the hope that's possible because what we do is so incredible. So it's a fine line, but it's also an incredible opportunity. And I think done in a very, appropriate way could be something that literally transforms people's lives. For example, I just had a gentleman fly from Washington, D.C. to come get care because he watched a YouTube video of one of my patients giving a testimony about his experience.
Wow.
And the gentleman called my office, booked a week, and came out, and he's transformed. So there's a lot of
Amazing.
power in the ability to share our story. And we just have to do it in a really, safe way.
Safe way.
Yeah.
What can someone expect from a chiropractic visit?
Well, I cannot speak for all chiropractors. I can just share, what I do in my office every single day. And all of our new patients, we just start out with a consultation. I want to sit down with somebody. I want to understand what they're bringing to the table. And I also want to make sure that I feel like they're in the right place to receive help, that they have a problem that I can help them with. And if we're on the same page when it comes to that, next step for me and also for Dr. Hafer is to do a really thorough exam. You wouldn't walk into a dentist's office and be like, I think it's this tooth.
Right.
Drill here.
Oh.
So we examine the patient, we take imaging, we do a lot of neurological testing, we do orthopedic testing to get to the root cause of what's going on. So we gather information, then we sit and analyze that information. And then when the patient comes back, we have everything we need to actually hit the ground running. And I think that very first adjustment that patient receives sets the trajectory of care moving forward. So I just want to make sure that we're doing it right the first time and every single time.
And speaking to that, oh, go on.
No, go ahead.
Speaking to that, how often does someone need to see a chiropractor for
Great
optimal
question.
care?
It really depends
Yeah.
on the person, the circumstances of which they find themselves in. And I think what we both say to our patients is that the more stable you become, the better you do over time, the less often you need to have an intervention or have a check, but never will you not want to have a check. So when I take care of my patients, we typically do like an 8-week care plan where we're stabilizing their neurology because it takes 6 to 8 weeks for that to occur. And that's just a physiological fact. After that 8 weeks, we start reducing the amount of times that they need to be in our office because they've reached stability and they have more capacity and they have more resilience. And that's what we want to have our patients do and have is like more resilience, more ability to live their life without pain, without the issues that brought them in. And, it could look different for everybody, but it's a lot less often with upper cervical care compared to a traditional chiropractic adjustment because we're not just going to have them lay on the table and manipulate their neck every single time they come in.
That I think touches on one of those misconceptions that we were getting at. I think there's this misconception out there that once you start going to a chiropractor, you're going to have to go twice a week for the rest of your life.
Right.
I've
Because
heard that.
somehow
I've
your
heard that
body
too.
just needs to have those adjustments. And honestly, in our world, I don't think that could be farther from the truth. And I'm really honest with my patients. We do work hard up front. We put in the effort, like Liz said, to get that strength and stability back. But if we're all doing our part over time, you should need less and less of me as time goes on, because that's a sign that things are healing. And of course, I'm an advocate for caring for your spine throughout your lifetime, but it shouldn't ever require as much effort to keep things happy as it does to get them back there initially.
That makes sense.
Yeah.
So if someone's coming into your office pretty regularly, I'm sure costs can add up. What resources do you offer in your offices to help patients pay for this care?
Absolutely. So we offer different payment options. We also utilize CareCredit, and I think that's a great way to make care accessible to people that truly need it in a way that is on their own terms. And so we're really happy to offer that as an option in our practice. And then we just kind of are really transparent about our fees. We never surprise anybody with anything up front. Everything's discussed in a consultation before anybody ever spends a dime of money in my office.
Okay, it's time for Ask the Expert. This is where our audience gets to ask you questions anonymously because they're coming through us. Okay, you ready? Okay, here's the first one. Is it normal to feel sore or have some discomfort after a chiropractic adjustment? Dr. Hoefer.
It can be normal for that to occur because if you think about it, if you come in a certain kind of position or a certain kind of way and your body's used to being in one position and then we change it, your body has to respond to that. So just like when you go to the gym and you do a really intense workout and 3 days later you feel like you can't walk up the stairs, it's never going to be that bad, but that's the analogy because people understand that.
Definitely.
So it's totally common and it's not a deal breaker.
Okay. This next question is, are there any age restrictions for receiving chiropractic care? So children can.
Absolutely.
Oh,
I've
Dr.
had
Jane.
the privilege of taking care of women throughout their pregnancy. And sometimes the first stop on their way home is to my office because they want to get their newborn checked.
Wow.
Even the most normal, natural birth can be very difficult on a little spine. And it's
Yes.
not that all newborns need to be adjusted, but it is always super important to check
my
to set that new life off on the right foot, both from a structural growth perspective and from a neurological perspective.
Yeah, and I had the privilege of being a part of my first daughter's home births. So I was with her, helping her get through that amazing process. And as soon as my granddaughters were born, I got to check them and adjust them. And they weren't even detached from the umbilical cord.
Oh my God.
And so being able to have that kind of impact in my granddaughter's life, knowing that from the moment they took their first breath, they had full neurological connection, there is nothing like it.
Incredible.
And then on the other end of that, I take care of patients in their 90s.
Yes.
And because the techniques that we use are so gentle and they're so precise,
Right.
even folks who have a hard time with mobility and who are quite stiff or rigid, they do really amazingly with care too.
Oh, it sounds restorative.
Yes.
Yeah.
Great.
It does. Okay, Dr. Hoefer, can chiropractic care be beneficial for athletes or those with physically demanding jobs?
Yes, because I personally live that physically demanding job thing. We are business owners, and not only are we adjusting patients, but we're managing the world of being an entrepreneur, So there's an emotional toll, a financial toll, a physical toll that comes into play with the work that we do. I take care of professional athletes, so it absolutely can play a role in helping the athlete to the busy working mother stay on top of their game and really win at life.
I love that. I want to win at life.
I
Okay.
know. Sign me up. This next person asked, and maybe Dr. Jane, you could talk about this. I'm currently 5 months pregnant. What are some adjustments that are safe during pregnancy? Are there any limitations throughout the different trimesters?
That's a great question. So we use pregnancy pillows in the office. These are pillows that are designed to accommodate a growing belly, and that way a pregnant woman can lay face down and receive chiropractic care in a safe and comfortable way. And so I love for my patients to let me know as soon as they are pregnant. Sometimes I'm the first person to know before they've told everybody. And once I know, we really start using those pregnancy pillows to just give that abdomen a little bit of extra support. And, the methods that we use, and again, going back to the Webster technique that we talked about before, that was designed for pregnancy and for those changing needs. And so not only are there no limitations, but I would encourage anybody who is pregnant to seek out the care of a chiropractor because it is going to make that pregnancy just so much better. And I've had the feedback from patients who maybe didn't have care during their first pregnancy and found a chiropractor and started care during a second or third pregnancy. It's a night and day difference.
Night and day.
And the second part of that question about there being limitations throughout the different trimesters, are there any?
I would, as far as the chiropractic care is
Yes.
concerned,
Yeah.
no, I wouldn't think so.
Getting bigger, maybe, is what they mean.
Like
No.
further along in the pregnancy?
Yeah, no, I mean the more the abdomen grows, the more support they're probably
right.
going to need, but there isn't any contraindication
That's right.
to having care because of the way that we change the techniques
Right.
and apply the science of chiropractic to the changing body.
That makes sense.
Okay, here's the last one. I experience lower back numbness and pain when sitting, even for short periods of time, like at a dinner or on short flights. what treatments or exercises would you recommend to help this? Either one of you could take this.
I think the first and most obvious answer is go get your spine checked. And I will always be a big proponent of imaging. Seeing is knowing. And if we could see what's going on in there and that can help guide our care and guide our outcome measures, that's going to be even better. And that way, if there is something else going on that we can detect in that imaging, we can make the appropriate referral. So I would definitely start with that chiropractic care and some of the exercises we talked about with core strengthening and just getting up and moving when you can.
Anything you want to add, Dr. Hoefer?
Nope, she nailed it.
Well, I think you both nailed
Yeah.
it. Y'all are so great.
Great.
Thank you so much for coming in and just educating us and breaking down some of those misconceptions about chiropractic, because a lot of people need more access to just feel whole again.
Yeah, thank you.
And you know what? We're so blessed to be able to have the conversation and have such interesting and really appropriate questions, because we always want to tell the truth and we always want to share the truth. We just don't often get a platform to have the access to do so. So we're so grateful and thank you so much.
Well, thanks for coming to Care Experts. You can
Yes.
come back if you'd like.
Yeah, we want you back.
All right,
People need
great.
to learn from you.
Yeah,
Thank
they do.
you.
Thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All product, service, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.